If you have ever experienced a severe toothache, you know the exact feeling. The relentless throbbing, the sleepless nights, and the desperate thought that sitting in the dental chair and asking for an immediate extraction is the only way out. Permanently pulling the tooth offers an incredibly tempting solution. The moment that tooth is gone, the immediate pain vanishes along with it. But your mouth does not function as a row of independent pegs. It operates as a delicate, interconnected biomechanical ecosystem. We have to look at what actually happens beneath the surface the exact moment you choose to permanently remove a natural tooth. Because taking the absolute quickest route to end today's dental pain often guarantees long-term structural damage to your face. Your teeth and your jawbone rely on a highly cooperative relationship. Every time you chew a piece of food, the physical pressure sends energy down the living root of the tooth, stimulating the bone beneath it and keeping the matrix strong. When you extract that tooth, you sever the connection. Without the root to provide that daily stimulation, the surrounding bone completely loses its mechanical purpose. The biological response is rapid. Within the first year of losing a single tooth, your jaw will lose up to 25% of its supporting bone density in that specific area. Over time, this localized bone loss physically alters your facial structure, often creating a sunken, prematurely aged appearance around the mouth, and the damage continues to spread. Your teeth rely heavily on lateral support from their neighbors to stay upright, much like books stacked firmly on a shelf. Pull one of those supports away, and the mechanical balance fails. The remaining teeth naturally begin to tip, shift, and drift into the newly created void. This drift throws off your natural bite alignment, making it harder to chew. It also creates deep, angled pockets between the leaning teeth, where plaque easily builds up, causing further decay. Pulling a painful tooth entirely fails to cure dental disease. It simply relocates the stress and multiplies your risk across the rest of your mouth. To stop this structural collapse before it begins, modern dentistry utilizes a precise medical intervention, root canal therapy. Outdated rumors have given the procedure a heavy stigma, but clinical techniques have advanced. By using detailed 3D imaging and highly effective local anesthesia, a modern root canal feels incredibly similar to getting a standard filling. The mechanics are straightforward. The infected, inflamed tissue causing your pain is carefully cleaned out from the upper portion of the tooth, and the empty space is fully sealed to prevent future infection. This accomplishes a crucial architectural victory. The natural, load-bearing root of your tooth remains firmly anchored right where it belongs. By keeping that living root in place, your jawbone receives the exact daily stimulation it requires to stay dense, and your neighboring teeth keep the sturdy placeholder they need to stay perfectly aligned. You retain your natural bite force, allowing you to eat your favorite foods without hesitation or structural weakness. Preserving the tooth nature gave you is a feat of biomechanics that no laboratory-created replacement will ever be able to fully replicate. Despite the clinical benefits, many patients still lean toward extraction for a very practical reason. The initial upfront price of pulling a tooth appears significantly cheaper than treating it. This chart compares the single cost of a root canal to the cumulative escalating cost of an extraction followed by a future dental implant. Leaving a biological gap guarantees the shifting and bone loss we just covered, meaning you will eventually need to pay for an expensive, time-intensive implant or bridge to repair the secondary damage. When you evaluate the lifetime health of your mouth, keeping your natural tooth today is the most cost-effective, least invasive financial choice you can make. There is absolutely no reason to let outdated myths or initial fear cost you a permanent part of your smile. If you are in Toowoomba, Westbrook, or the surrounding areas, reach out to the team at Westbrook Family Dental. We offer modern, stress-free options, including sedation choices for nervous patients, to resolve your tooth pain the correct way. True, lasting dental care is about actively preserving the biological foundation of a healthy smile, so it stays strong for decades to come.